Then we're going to move to our next presentation. And if I see this correctly, this is Danielle, right?
Hi, everyone. I'm Danielle Andrade. I'm an adult neurologist focused on genetic epilepsies. And I'm from Toronto, and you're going to see some pictures of the CN Tower and a few pictures of Toronto. I'm actually not originally from Toronto, but living there for a while. Anyways, I want to first of all thank Mike and the SRF, because this research actually started with a different disease. We were looking for understanding the phenotype of others' disease, and Mike actually said, why not SYNGAP1? And I said, well, why not? I guess we could study SYNGAP1. Do you think you can find patients, adult patients with SYNGAP1? And he immediately jumped on that. And the whole group helped us find these patients with SYNGAP1, and that's what I'm going to present to you now. So the outline, we're going to be talking about seizures, longevity, pain, sleep, gait, social communication, and adaptive skills. So the motivation behind this is we have a transition clinic which helps patients graduating from pediatric hospitals to adult hospitals. And we realized that many of the pediatric epilepsies, not many, but a good part of them, especially those associated with genetic disorders or genetic syndromes, were very unknown to the adult neurologist. And this is 8 years back. So before we knew about many of the DEEs that we know today. So that's why I have this interest in understanding more about adults with genetic epilepsies. This is a review we did showing that Dravet syndrome, which is one of the most well-studied DEEs, for every 7 papers in children, there's only 1 in adults. So the adult neurologist really does not have much information about these DEEs. Regarding SYNGAP, when we started this work, there were over 300 patients described, and only 11 of those were over the age of 18 years. And they were spread in different 8 papers. So it was really difficult to make sense of them. And of course, part of this is because the genetic diagnosis only became available recently. So these adults probably had the $1 million workup when they were young and started with symptoms, but at that time we didn't know about SYNGAP1. So the goals of this study were to describe the clinical characteristics of these patients regarding seizure, gait, communication, and autism, as well as daily living abilities. We try to do a genotype-phenotype correlation and understand the caregiver's subjective impression of their loved one's conditions. So we used a few tools. So the severity assessment is derived from the one designed for CDKL5 by Team Bank. And the other tools are well established. I mean, the severity assessment is also well established. The social communication questionnaire, Vineland, and then the caregiver ratings. So this was done during the pandemic years. This is patient-reported outcome. There's an issue with this slide. I'm going to skip it. So here's what we found. So we were able to contact 14 patients over the age of 18 years. Half of them were females. The average age was 21 years with a range from 18 to 65. A family history of seizures was seen in over a third of them. And we didn't know in about 15%, no family history in 50%. We described this patient that many of you might know. She's a 65-year-old patient, the oldest adult that we are aware of. She has today moderate intellectual disability. She was diagnosed with autism spectrum disorder. She still has drug-resistant seizures, feeding challenges, sleeping problems, toileting issues. She does have self-injurious behavior and aggression, and she requires a wheelchair to move from place to place. So this is, in a nutshell, a description of an older adult with SYNGAP1. In terms of seizures, half of the patients were still having seizures when adults, and usually on 2 anti-seizure medications. Several types of seizures, some of them still had cluster seizures. But there were patients that were completely seizure-free. In terms of a delayed pain response, that was seen in all adult patients. It's a bit different from what was seen by Danica Basklump from Dr. Ingrid Schaefer's group. Might be a question of just asking the question differently. Here we asked if there was even any minor change to pain processing. So if we count everyone with minor or more medium or severe abnormal pain response, 100% of the adults had that. In terms of sleep, that was also seen in a larger number compared to children. So 86% of the adults had some form of sleep problems with, I think 4 of them awakening at least or less than 1 time a week, and then about 8 waking up more than once a week. And daytime sleepiness was also a problem in a large number of them. In terms of walking, the majority of the patients could walk independently or with minor assistance. There was only a small number of patients that could not walk independently or would just walk indoors. In terms of other symptoms, constipation was an issue for some of the patients. The black bar is the normal one, so you can see that it wasn't much of an issue, both constipation and reflux. Toileting, we had about 5 patients that were timed, 5 patients that were on diaper, and 4 patients that had normal sphincter control. In terms of autism traits, we didn't do the proper autism diagnosis tests. We did, which is proper, it's a screening for autism, which is called social communication questionnaire. So that is a screening that if the patient screens positive, then you suggest a proper formal investigation for autism. And this might explain, again, the difference between the numbers in the adult and the pediatric population. So we saw that 79% of the patients screened positive for autism. And the things that were most prevalent in this group were deliberate self-injury, special interest with unusual intensity, and ritual-like behaviors. In terms of maladaptive behaviors, self-injury and aggression, unfortunately, were more common. So when we were doing this investigation, we were also looking at patients with a different form of epileptic encephalopathy, adults with CHAD2. And even though self-injury and aggression were seen in those patients, and even though we're talking about a small number of patients for both conditions, it looked like SYNGAP patients were more, there was a higher prevalence of those issues, self-injury and aggression. In terms of reliance on caregivers, the adults have a little bit more independence, and we were very lucky. There was another study that was published just this year looking at independence of children. And when we compare adults and children, they were a little more independent, but not really too much. So here are the items. So speaking short sentences, eating independently, collaboration during personal hygiene, and simple dressing unassisted. And then we asked the parents, what are your main concerns now and when your loved one was a child, and is there any overlap? And what we saw is that for what they thought when the loved one was still young, the main concerns were the developmental delay, the issues with education, inability to attend school, and the intellectual disability. In the adults, the lack of diagnosis. So many adults were really diagnosed very late. The transition from pediatric to adult care, which was not easy for many of them, and the inability to participate in adult life. And in the center of this was a problem before, continues to be a problem: seizures, high reliance on caregivers, behavioral difficulties, and financial burden. And in terms of what the caregivers cited most frequently, communication and behavior, as well as clinical outcomes, were the main concerns. And the black bar is Child 2, the other disease we compare to. The pink bar is SYNGAP. So you see that SYNGAP parents were a little more concerned about communication and behavior. So just to summarize, adults, the clinical characteristics of adults vary. They rely heavily on caregivers for daily living, slightly better, but almost similar to pediatric patients. This was a very small sample. We couldn't do any genotype-phenotype correlation. We didn't see any phenotype-genotype correlation. And the clinical outcomes, communication challenges, and behavior are impactful on the adult life of these patients. So Marlene, the one on the right upper corner, is the graduate student who did all this research during the pandemic. She received an educational fund from Biocodex, and SYNGAP Research Fund was really allowed us to do all this research with the patients. So thank you very much.
Thank you so much, Danielle. I think we can take a few questions again, and I think we might, for time reasons, limit this maybe to 3 questions.
Yeah, do you think that the more mild cases in pediatric, the pediatric cohort, has to do with how people are getting diagnosed? Do you think that there'll be more mild cases later in adults?
I think if you have an early diagnosis, you're more likely to look for better treatments or ways of coping, and perhaps precision medicine. We're not there yet, but certainly I think the impact will be better if you have an early diagnosis. So yeah, that could be the difference, but could also be, we didn't really ask exactly the same questions, so it might be a bit tricky to compare.
What else do you want to do with adults?
Oh, there's so much more. We want to understand better their, so that was just an initial overview, but what medications work better for them, what medications didn't work for them, what medications other than seizures they are still taking. We need to understand more about their, I think the issue of behavior and aggression was a big one. And is it somehow related to the insensitivity to pain? Is that a self-stimulating behavior? What's the relation there? So there's a lot of questions that we still need to clarify.
Hi, Dr. Andrade, thank you. Very few researchers respond favorably to my harassment on Twitter, and much less do do research because of it, and I am grateful for how gracious you are. And I just want to, for the parents in the room, I want to acknowledge that you are the world's leading expert on adult genetic epilepsies, and we are really blessed to have you working on this. Just one question. When are you going to ask us for money to do more work? Because I'm waiting for a proposal.
Pretty soon, don't worry, I'll ask.
And one last question, please.
Related to the aggression, that we have a big problem when the kids get older, they can really escalate. There is any work for treatment, therapy? I mean, a lot of us are in the behavioral space. It's the only thing we kind of see that makes a big difference. Medications doesn't seem to knock it down that well. Any suggestions for parents that we are going, or the ones that are getting the kids older and having more problems with aggression, management of aggression?
I'm sorry, Marta, I still don't know much about that. It's probably on the next grant. We're going to be looking into that, but it's certainly an area that deserves way more attention.